Sensory processing disorder is a very real and sometimes very scary situation. From the issues with getting clothes on, the textures with food, and the severe meltdowns that make you wonder, is there something really severely wrong with you or your child? Watch till the end of this video to find out where sensory processing disorder actually comes from. Hey, I'm Dr. Sam McDonald, brain health expert, helping you rewire your brain so you can live a better life. If you love this content, make sure to like and subscribe so you get the notifications for each week's new video. So if you're unfamiliar with what sensory processing disorder is, or SPD for short, in a nutshell, it's a neurological condition where the brain does not perceive the body in the way that it should, meaning that sometimes you can be wearing certain clothing that can cause sensations that the brain is perceiving as pain, or maybe you are wearing socks that perceive as discomfort or scratchy or itchy, when in reality maybe they're very soft or very comfortable. In more severe situations, it can be even perceiving surroundings in a way that is more threatening instead of being more calm or more relaxed. So in my practice, where I see a lot of sensory processing kiddos, one of the most common questions that I get from typically moms is, where does SPD actually come from? And in our clinical experience, we've really identified three major areas that contribute to SPD issues in a kiddo. Most commonly, the thought process is that it's genetic. We really have not seen that played out at all in our office, even though that's typically the scapegoat. So if you're thinking that maybe this is my fault, I passed this on to my kiddo, please rid yourself of those worries. It's most likely not a genetic factor. However, it can be more of an epigenetic factor, which we'll tie into of the top three causes that we see that cause SPD. So the first cause that we see that contributes to or causes SPD is maternal stress during pregnancy. So when baby is inside mom, they are feeding off of all the neurochemistry and all of the things that are happening inside of mom. And if mom is going through a very stressful pregnancy, meaning that she's dealing with a lot of maternal stress could be from finances, it could be from work, it could be from a significant other, it could be from maybe paying attention to too much of the news out in the world. Whatever the contributing stress is, it doesn't really matter. The body's all perceiving that as a survival type of stress. So imagine if you're trying to escape a burning building, what's going to happen? The fire alarm's going to go off. It's going to tell you need to get out because the building's on fire. Well, your brain does not know the difference between that kind of fire alarm stress or any of those other perceived stresses like I talked about, whether it's finances, work, relationships, all those things. It's all stress to the brain. And when that happens, your brain goes into a survival mode, and the baby starts to feed off that neurochemistry and all of that neurology. Thus, you're starting to prime their brain and the nervous system to be in a more heightened, anxious state upon being born into the world. So that is one of the more contributing factors that we see in almost every SPD case. Now, the second form, or the second correlation that we see with SPD, actually comes from birth trauma. So any type of high maternal stress is typically going to lead to a more difficult delivery. Not always. Sometimes we'll see a low stress pregnancy, but then we'll see birth trauma issues. And when I'm talking about birth trauma, I'm actually talking about damage and issues up to that upper cervical area in the neck. So when the baby's coming down through the birth canal, obviously we want the baby and the mom to both be healthy and alive after this process. But sometimes there can be interventions that happen, whether that's using forceps or vacuum extraction, or sometimes done by the hands if it's a C-section delivery. But what can often happen is the doctor is going to start to use an axial traction or a pulling force on the upper cervical area on the neck to get the baby out. And what that does is that causes a stretch and damage to the actual brainstem area. This is really critical and important because the brainstem is responsible for all of our essential life functions. So things like breathing, digestion, heart rate, all of that information has to come from there to regulate the body, and all the information from the body has to come through that brainstem area to go up into the brain. So if there is birth trauma intervention, anything in there, that can be a huge contributing factor, because now baby has a damaged brainstem. There could be some signs of this, meaning like maybe they're not eating, they're having trouble feeding, they're not sleeping, or they're not sleeping well, or they're not pooping, they're constipated, those kind of things. Those are all big warning signs that there is brainstem damage and brainstem issues, because in that first year of life, a baby really only has three basic programs. That's eat, sleep, and poop. So really important to understand, hey, this is what I'm looking for when we see if there's any kind of brainstem damage or brainstem issues. All right, so the last thing that can cause a sensory processing disorder issue is going to be a lack of proper brain development. So after that potential birth intervention or birth trauma event, if that did happen, maybe it didn't, but now we have to look at how is the baby's brain developing and growing over their lifespan. So especially that first year of life, there's these things that are called primitive reflexes. Primitive reflexes are like the training wheels for the brain. Their whole job is to get baby up and walking so that they can then move on and develop more advanced programmings, meaning like speech, language, rational thought, emotions, all those things that come after that first year of life. But in that first year of life, we have to make sure that they're hitting all these proper milestones and that their brain is growing and developing enough so that can start to inhibit or turn off these reflexes. Now, most of the kiddos that we see with sensory processing issues, if they're below the age of 1, we'll often see that they don't have these reflexes present, which is a big deal because now the brain is not on that proper trajectory. Or if they're over the age of 1, we'll often see that these reflexes are still present, which means that their brain is not developed enough, meaning that it doesn't have the proper programs in place to be able to perceive the information that's going on around the environment. So again, that sensation of maybe putting on pants or socks, they can't stand that because their brain is not gating that information appropriately. It's not keeping that information out of the brain, meaning it's not dampening and turning it off or filtering it, so to speak. It's not filtering it out so that they're constantly feeling this uncomfortable, scratchy material. Or maybe they can't ignore the information coming from outside, the noise or music or something in the background. They can't focus on what's going on. That's also a more classical ADD pattern, but that's also can be a sensory processing issue because they're not processing all the sensory information coming in. So to recap, what can happen in this chronological timeline? You can have maternal birth or maternal stress during pregnancy that can lead to this whole sympathetic fight or flight windup in the baby being born. Thus, they're in a more high stressed tone in that first and potentially their entire life, but especially that first year of life. So that can be a major contributing factor. You have birth trauma, again, damage to that brainstem upper cervical area. That can cause major issues and contribute to this SPD cascade. And then finally, you can have lack of proper brain development, which is going to lead to this issue of not being able to gate information appropriately, thus leading to those SPD cascades that you see. So final question then is, okay, what can you do about it? Well, you need to go see a neurological rehab specialist, someone like our office, or a chiropractor who's been trained properly in pediatrics that understands what to look for when it comes to primitive reflexes, developmental milestones, as well as how to adjust their baby appropriately in order for their brain to start to integrate all this information correctly. So on that note, you should be healthy by choice, not by chance. And for that reason, I will see you on the next video.